Part 5. Advice and support for employers. With the proposals in this consultation, the government is aiming to help and encourage employers to take early and sustained action to support their employees' health. To be effective, these measures need to be backed by good quality advice and information. Employers should feel confident enough to engage with their employees and have the information they need to follow the law. Otherwise, changes to the law and workplace procedures will not work. Evidence suggests that employers often do not understand or are not sure of what their obligations are on disability in the workplace and sickness absence. Sometimes employers are worried about doing the wrong thing. A lot of information is already out there, but some can be irrelevant, broken up, or it is not easy to use. This is particularly true for small to medium-sized employers, SMEs, who need it most. This can make it harder for employers to understand and carry out their obligations. Confusion can also lead to lack of confidence. Similar issues might put off employers from buying quality occupational health (OH) support because the process can be complex. The government is running projects which aim to identify the best ways to communicate with SMEs and the messages most likely to work. Addressing information needs. Improved advice and information provided by government could support the management of health in the workplace. It could also help employers to be better informed when purchasing quality advice. This information would primarily target SMEs and self-employed people. The advice and information could include employer responsibilities and obligations, examples of good practice, support for sickness absence, management and keeping employees in work, adaptations and adjustments to the workplace, and signposting to other information. Supporting employers to purchase OH. Employers and providers often do not have the right level of information needed when buying OH. Small employers are less likely to have access to expert support, such as HR staff, to help when buying these services. Providing information on how and where to buy OH services could make it more likely that employers can identify the right OH services. Improving employers' knowledge and confidence could also encourage more competition in the market that helps increase the quality and value of services employers receive. promotion of advice and information. The right advice and information needs to reach a wide range of employers and employees. It would be supported by a national campaign, particularly aimed at SMEs and self-employed people. This would explain the benefits of a healthy and inclusive workplace to employers, offer practical advice on supporting people to stay in and return to work, and direct employers to further advise and support. Targeted and timely interventions. Some employers do not think about sickness absence until they need to. When this happens, SMEs in particular might not have the ability to manage it effectively. Providing guidance to an employer at the time they need it could reduce the risk of their employee falling out of work. Currently, the government does not collect any data on sickness absences, but many employers already record relevant data through the recording of SSP payments. The government is considering the idea of employers automatically reporting sickness absence through their payroll system. The government could use this data to provide helpful prompts to SMEs on how they can best manage their employees' sickness absence. This could include directing employers to relevant guidance on reasonable adjustments, or on how to engage with employees in a helpful and sensitive way. Next steps. In this consultation, the government wants to make sure that employers have the skills and confidence to manage health and well-being in the workplace, and that they are clear on their responsibilities to their employees. These proposals are intended to form a balanced package of measures which, when taken together, aim to reduce ill health-related job loss. These proposals build on a wide range of research in this area and feedback from experts and important stakeholders. The government will use the evidence and views gathered during this consultation to develop these proposals further and understand the impact of the changes on both employers and employees. Alongside this, the government will carry out workshops to further explore the proposals in detail. This is an opportunity to make a valuable contribution to shaping policy design in this important area and helping to transform the lives of disabled people and people with health conditions.